SSS 10-5 foam is a medication used to treat various skin problems such as acne, rosacea, and seborrheic dermatitis. It contains sodium sulfacetamide, which is a type of sulfa antibiotic that works by killing bacteria on the skin that can cause acne and other issues. Additionally, the sulfur in this product helps to remove dead skin and unclog pores. The recommended daily dosage and optimal timing for using this foam should be determined by your healthcare provider. Make sure to follow all the directions on the product package, and if you have any questions, ask your doctor or pharmacist. This medication is for use on the skin only, so be careful to avoid getting it in your eyes, nose, mouth, or on any broken skin. If this does happen, be sure to flush the area with cool water and wash your hands with soap and water after each application. Before applying the foam, clean the area of skin with a mild cleanser and pat it dry. Shake the container well before each use, and depending on the brand, you may need to prime the container before first use. Follow the package directions for your specific brand. Apply a small amount of foam on the fingertips and massage it into the affected area. Depending on the brand used, wait between 1 to 10 minutes. Rinse the area well with water and pat it dry, unless your doctor directs you not to wash the foam off. Be sure to use this product as directed by your doctor. The dosage is based on the brand you use, your medical condition, and response to treatment. Use this medication regularly at the same times each day to get the most benefit from it. Do not use more of this medication, use it more often, or keep using it for longer than prescribed. If your acne does not improve or if it worsens, be sure to tell your doctor. If you experience redness, itching, swelling, or flaking at the site of application, you should consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks. While many people using this medication do not experience serious side effects, it's important to be aware of potential issues. Although serious side effects are unlikely with sulfa medications applied to the skin, they have rarely occurred with other sulfa antibiotics taken by mouth. Contact your doctor immediately if you experience serious side effects such as easy bleeding or bruising, unexplained fever, fast heartbeat, signs of infection, bluish or pale skin, severe stomach or abdominal pain, unusual tiredness, dark urine, or yellowing of the eyes or skin. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. Remember to consult your doctor for medical advice about any side effects, and report any side effects to the appropriate regulatory agency. Before using SSS 10-5 foam, make sure to inform your doctor or pharmacist if you have any allergies to sulfacetamide, sulfur, or other sulfa antibiotics. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease. It's important to note that this medication may make you more sensitive to the sun. It's recommended to limit your time in the sun, avoid tanning booths and sun lamps, and to use sunscreen and wear protective clothing when outdoors. If you experience sunburn or skin blisters/redness, be sure to inform your doctor right away. Before undergoing any surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When using SSS 10-5 foam, it's important to be aware of potential drug interactions. Certain products, such as those containing silver that are applied to the skin, may interact with SSS 10-5 foam and affect how it works or increase the risk of serious side effects. It's essential to keep a list of all the medications and products you use, including prescription, over-the-counter, and herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. If this foam is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember to keep this product out of reach of children and pets to avoid accidental ingestion. It's important to remember not to share your SSS 10-5 foam with anyone else, as it is prescribed specifically for you. Also, make sure to keep all your medical appointments, so your healthcare provider can monitor your progress and make any necessary adjustments to your treatment plan. If you forget to use a dose, you can use it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and use the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store SSS 10-5 foam upright at room temperature and do not freeze it. The contents are under pressure, so do not puncture or burn the container, and keep it away from open flame or heat. Always keep medications out of reach of children and pets. Remember not to flush SSS 10-5 foam down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.